the barium swallow. So under the barium swallow, we are going to see some conditions and how they appear. So how does the diffuse esophageal spasm appear? Diffuse esophageal spasm. So how does it appear? It appears as a corkscrew appearance. Then comes, we are looking at the feline esophagus. So how does the feline esophagus appear? So there's a transient transverse. So there's a transient transverse bands. So there's a transient transverse bands, and it is seen in the mid and the lower esophagus. So it is seen in the mid. So it is seen in the mid as well as the lower esophagus. So it is seen in the mid and the lower esophagus on a double contrast barium swallow. So it is seen only in the double contrast. So double contrast barium swallow. So it is seen in case of, so the feline esophagus. Where is it seen? It is seen in case of the active. So it is seen in case of active gastroesophageal reflux, that is a GER, and also the hiatus hernia, as well as the eosinophilic esophagitis. Then we are going to look at something known as the achalasia. So how does the achalasia appear? So the achalasia, it is nothing but a dilated esophagus. So it is a dilated esophagus, and it has a retained column of barium. So it has a retained column. So retained column of barium is present, and also a bird beak appearance is seen. So all this is present in case of the achalasia. Next, we are going to move to the Zenker's diverticulum. So how does the Zenker's diverticulum appear? So Zenker's diverticulum, so under this there is a posterior outpouching. So there is posterior outpouching. So there is a posterior outpouching, and this is of the hypopharynx. So this is of the hypopharynx, posterior outpouching of the hypopharynx, and through a weakness in the muscle layer called the, so there is a weakness. So weakness of the muscle layer. So what is this weakness of the muscle layer indicating? So this is the Killian dehiscence. Next, we will look at the esophageal carcinoma. So what is this esophageal carcinoma? So esophageal carcinoma, there is irregular narrowing. So there is irregular narrowing. There is also mucosal destruction, and there is a shouldered margins. These are all seen in case of the esophageal carcinoma. There are shouldered margins as well. Next, we are looking at the Schatke's ring. So SCHATZHI, Schatke's ring. So this is nothing but a thin submucosal circumferential ring. So it is a submucosal circumferential ring. So this ring is present in the lower. It is present in the lower esophagus at the squamo-columnar junction. So SC junction is where the Schatke's ring is present. Next, we are moving on to the esophageal web. So esophageal web is seen in patient with the Plummer-Vinson syndrome. So it is seen in the Plummer-Vinson syndrome, and the esophageal webs are thin membranes of the normal esophageal tissue. So they are nothing but a thin membrane. So they are a thin membrane of the normal esophageal tissue, and it consists of the mucosa and submucosa. So it has a mucosa as well as a submucosa. So there is also a translucent part which denotes the esophageal web. There is also a translucent part. So this denotes the esophageal web. Next, we are going to look at something known as the esophageal leiomyoma. So what happens in the esophageal leiomyoma? So this is nothing but we need to know it is the most common, it is MC, most common benign tumor of the esophagus. So it is most common benign tumor of the esophagus, and on barium swallow it is seen in a discrete ovoid mass. So it is seen as a discrete ovoid mass that is well outlined by barium. So it is well outlined by barium. So it is well outlined by barium. So it is outlined by barium, that is a smooth submucoid mass. That is the smooth submucoid mass. Next, its borders form slightly obtuse angles with the esophageal wall. So its borders, so if you see the borders, they form slightly obtuse angle. So it forms a obtuse angle with the esophageal wall. Obtuse angle with the esophageal wall. So the image below depicts the barium study, shows the classic semilunar filling effect. So I'll just draw it. So semilunar effect. So basically it goes like this. So this is nothing but the semilunar effect. So this is nothing but the semilunar effect. So this is nothing but the semilunar filling defect. So this was nothing but about the barium swallow. So to learn and grow daily like this, please do subscribe.